Hi everyone, I wanted to go over the DRX9000 and the most common questions new patients have. How does spinal decompression work? Simply put, it works by enlarging the space between the discs. To get more technical, negative pressure created by the DRX9000 releases pressure that builds onto the discs and nerves, allowing the bulging or herniated discs to go back to near normal as possible. This is the only non-surgical treatment that is truly effective for severe cases of degeneration, herniation, and spinal stenosis, and spinal arthritis. And that includes just general pressure on the nerve root. According to a clinical study performed by the Orthopedic Technological Review, showed that 86% of all cases experience spinal pain relief with spinal decompression therapy. Let's take a look at the technology behind spinal decompression therapy. Now, several tables are legally allowed to be labeled decompressive therapy, and they all basically do the same thing. We use the DRX9000 decompression suite for a reason. The DRX9000 is the only system with the FDA 510(k) certification. It's the only one that can be called a true spinal decompression system. And it's the only system with a proven 86% success rate for vertebral axial decompression. It's also technologically advanced so we can dial in and target a specific disc, whether it's L5-S1 or L3-L4, a specific motor unit. So it doesn't just pull on your entire spine, but focuses the decompressive treatment on the area that it needs the most. But what about surgery? At some point, surgery might become your only option, but that point is often further on than most people think. Don't wait until surgery is your only option. What about traction? What's the difference? There are big physiological and technological differences between traction and decompression. Traction therapy can become problematic. While it does pull on the spinal column, it might cause spinal segments to contract and muscles to become really tight and painful. And this muscular response can actually cause an increase in pressure and pain on the discs, which is exactly the opposite of what you want. Genuine and true spinal decompression like that done on the DRX9000 provides a calculated decompressive technique that can be monitored carefully and slowly increased with time. This means negative pressure, natural pain relief, and healing, literally from the inside out. Essentially, traction can't compare to true spinal decompression. What kind of results can I expect? Many patients feel pain relief by the third treatment on the DRX9000. Comparison in pre-treatment MRIs to post-treatment MRIs have shown a 50% in reduction in the size of the disc herniation. In the past 10 years, private practices that utilize the DRX9000 have seen success rates as high as 90%. Personally, I have not come across any other treatment that is even worthy of direct comparison with spinal decompression utilizing the DRX9000. How long is the course of treatment? Spinal decompression on the DRX9000 calls for 20 visits. We like to do the visits close together, so 3 to 4 times a week. Most patients, if done properly, will finish the treatment between 4 and 6 weeks. In my practice, we also make a point of checking in on you periodically throughout your decompression treatment protocol. And it's really the doctor-patient relationship that makes a difference. Will decompression work for everyone? 89% of the patients will have either good or excellent outcomes. And as always, patients' results will vary based on age, sex, patient morphology, and underlying mechanical issues. And we also touch on things like nutrition and ergonomics and lifestyle changes to make sure this thing sticks. Does insurance pay for spinal decompression? In many cases, insurance isn't going to pay for this, but we do have affordable financing options, and we do our best to work with our patients so they don't have to worry about their finances. They have to worry about getting better and getting back to their lives without pain. And to be quite honest, insurance doesn't like paying for anything these days, but that's another topic. Now, there are a few insurances out there that will cover it, but you'll have to reach out to us, either email us or through social media, and as a courtesy, we'll do a check, and we'll see if it's a plan that we can make it work. Other than that, please reach out to us. We'll do our due diligence and do our homework to find out if your plan will cover it, but like I said earlier, most plans don't. So I hope I cleared things up a little bit and got you excited about real, natural spinal decompression with the DRX9000. I understand that you might have a few more questions, but my website has a very detailed page specifically on spinal decompression. You could reach out to us on phone, text, or social media so we can get you the help that you need as soon as possible.